My name is Willem van Schaik. I'm Professor of Microbiology and Infection at the University of Birmingham in the United Kingdom. I've been asked by Docspert.com to give some advice on coronavirus for people in Egypt and the Middle East. A new coronavirus called SARS-CoV-2 has emerged in December 2019 in China, after the virus jumped from an animal host to one or more humans. SARS-CoV-2 causes an infection called COVID-19. This is generally a mild disease, but 5 to 10% of patients will need intensive medical care. The case fatality rate is between 1 to 2%, making it about 10 times as deadly as flu. People in their 70s and 80s and those with underlying health conditions are at particularly high risk. The time between exposure to the virus and the first symptoms is usually between 2 and 7 days, but can take up to 14 days. Coronavirus spreads to small droplets in the air that are produced when people cough or sneeze. These droplets can land on surfaces that we touch with our hands, and if we then touch our mouth or nose, we may get infected. The virus does not survive for very long on these surfaces, so it's perfectly safe to receive packages from abroad. The symptoms of COVID-19 are fever, a cough, and in more serious cases, difficulty breathing. It can be difficult to distinguish these symptoms from common cold or influenza. If you have all symptoms, contact a healthcare professional. If you think you might be infected, do not go to a hospital yourself, as you may infect others. First contact your family doctor or the hospital for advice. At this stage in the outbreak, you are most likely to have caught the disease by contact with another patient and/or by travel to a region with high numbers of COVID-19. If you plan on traveling, please check websites with travel advice like the UK Foreign Office or the Centers for Disease Control in the United States. They will be able to tell you whether it's safe to travel to your intended destination. The most important way by which you can protect yourself from COVID-19 is by regularly washing your hands with water and soap. Take at least 20 seconds to wash your hands, including the space between your fingers and under your nails. If you are healthy, there is no reason to wear a face mask when you are walking on the street or doing your shopping. COVID-19 patients can wear face masks to minimize the risk of them spreading the virus. There currently is a global shortage of face masks, and we need to save these for patients and healthcare professionals that really need them. Healthy people should not be buying face masks unless you are caring for a patient with COVID-19. COVID-19 is generally a mild disease, and there is no reason to become overly concerned. Thousands of patients have already had the infection and have fully recovered. However, it is good to be cautious and to strictly follow the advice of healthcare professionals, which will help us all to minimize the spread of the infection. There are currently no vaccines, drugs, or treatments against COVID-19. Please note that COVID-19 is caused by a virus, so antibiotics will not help against the infection. The world is going through a serious health crisis right now, and we can all contribute to minimize the spread of COVID-19. We can do this by regularly washing our hands and by contacting healthcare professionals if you have symptoms, cough, fever, and difficulties breathing. Thank you for watching. I hope you found this video useful, and please feel free to share.